Dear students and my dear viewers, welcome back. In this session, we are going to discuss about some congenital anomalies of the kidney. Firstly, we are going to discuss about one common congenital condition of the kidney, that is the polycystic kidney. Okay, this polycystic kidney is a genetic disorder. The major portion of the renal parenchyma is converted into cysts of varying sizes. In this picture, you can see both normal kidney as well as the polycystic kidney. And on the surface of the kidney, in the case of normal kidney, the surface of the kidney is smooth. Whereas in the case of polycystic kidney, the surface of the kidney consists of different sizes of cysts. Okay, and if you compare the sizes of the normal kidney as well as the polycystic kidney has an abnormal increase in size. So here, if you see the polycystic kidney, this is a developmental disorder which occurs in the nephron structure. As all know that this kidney consists of an outer cortex called as renal cortex and the inner medulla, isn't it? So this cortex, here you can see the cortex is mainly consists of the secreting part, while the medulla consists of the conducting part. Okay, and we all know that the secretory part and the collecting part mainly constitute a nephron. So the nephron is the functional unit of the kidney. So what are the parts which are present in the secreting part is, the secreting part of the nephron comprises a renal corpuscle. Okay, this one is renal corpuscle, proximal convoluted tubule, okay, and the loop of Henle and the distal convoluted tubule and the junctional tubules. So that the conducting part is mainly made up of with the collecting tubules. These are the collecting tubules. So these collecting tubules which open into the minor calyces. Okay. So what actually happens here is that there should be a proper union of the secreting part as well as the collecting part. In this condition or in this disorder, there is non-union of these two parts in some nephrons occurs. Okay, so this polycystic kidney is considered as a disease. So, and it occurs in two types. Okay, the first one is an adult type and the second one is called as infantile type. The adult type is called as autosomal dominant polycystic kidney disease, whereas the infantile type is called as autosomal recessive polycystic kidney disease. So what happens in the case of autosomal dominant polycystic kidney disease? Simply we can call it as ADPKD. So this is the abbreviation for this ADPKD. So here what actually happens? So we have already know that this is a genetic disorder. What happens here? There is a mutation occurs in chromosome 16. So what will happen in this thing? So in this condition, the cysts arise from all parts of the nephron. Here you can observe here, the cyst is arising from all parts of the nephron. So here you can see proximal convoluted tubule, loop of Henle, distal convoluted tubule as well as the collecting tubules. So it is the cysts are arising from all parts of the nephron, varying size from tiny cysts to 4 to 5 centimeters in diameter. This cyst does not communicate with the pelvis. Okay, so in this type the kidneys are abnormal at birth, renal function is retained, but the symptoms appear in the adult life between the age of 30 to 50 years. Some of the symptoms are hypertension, dull ache in the lumbar region, hematuria, that is blood in urine, and also urinary tract infections, which progressively leads to renal failure. So these are some of the symptoms of this autosomal dominant polycystic kidney disease. Okay, next we will move on to the second type, that is the infantile type. This infantile type is called as autosomal recessive polycystic kidney disease, so which is very rare, and this condition is occurs due to a mutation occurs in chromosome 6. So in this type, the kidneys are enlarged bilaterally and having smooth external surface, whereas in the polycystic adult type you can find a number of cysts on the surface, but here in this polycystic kidney the external surface is smooth and it also retained its normal shape. So the cysts are cylindrical in shape. Here you can see the cysts are cylindrical in shape, so which is formed from dilation of the collecting tubules which extend radially to the outer cortex. So here only the cysts are found in the collecting tubules, whereas in the adult type the cysts are present all over the nephron. Okay, so and this disease can be seen in perinatal, neonatal, infantile or juvenile stages, but frequently serious manifestations are present at birth and result in death from a renal failure in early childhood. So this is all about the polycystic kidney. And secondly, we are going to discuss another condition called aberrant renal artery. So what happens in this condition? So normally the kidney develops in the pelvic region, okay, and lies with hilum facing forward. So here you can see the hilum is on the medial aspect, but at the earlier stages the hilum is present or faced forwardly. Okay, so later it migrates to the lumbar region. So once the kidney is present at the pelvis and later it moves upwards to the lumbar region. Okay, so there the kidney undergoes medial rotation for 90 degrees so that the hilum turns medially. So the kidney, as it ascends, it derives blood supply from the fetal renal arteries. So here you can see the additional artery. Here you can see in this picture also you can see this is the additional. So these are the additional renal arteries which grow in sequence from the aorta. So actually this lower one disappears as the kidney ascends. So persistent fetal renal arteries are sometimes seen as aberrant renal artery. This may cross in front of the pelvic and uterine junction. So this one is the pelvis, isn't it? The pelvis, renal pelvis, and the uterine junction. So here this is the ureter. So this is called as pelvic ureter junction. So what happened? So if this artery is persist, so it can obstruct, causing obstruction at this junction, leading to the hydronephrosis. So this one is the hydronephrosis. So the collection of urine at the pelvic region. Okay, this is the thing happens in the aberrant renal artery. Okay, next we will move on to the next congenital anomaly, fetal lobulations. So here this one is the normal kidney and this one is the lobulated kidney. So what actually happens here means the fetal kidney presents fissures on the surface and presents a lobulated appearance. So like this. So at the fetus stage the kidney is like this. During development the surface gets smoothened by connective tissue growth. So rarely these fetal lobulations may persist after birth. So such condition is called as fetal lobulation. This is also one type of congenital anomalies. So in this session we have discussed about the polycystic kidney, aberrant renal artery as well as the fetal lobulation. In the next session we are going to discuss about some of the other anomalies which are seen in the kidney, like crossed ectopia, pancake kidney, horseshoe kidney, etc. We will see in the next session. Thank you.